Joining us from Canada is the CEO and co-founder of Rexall, the winner of this year's Global Deep Tech Prize for inventing handheld nanoscanners that can detect fake drugs. Thank you for joining us and congratulations.
Thank you so much. It's a pleasure to be here.
So what brought about this invention?
Yes, so I had a personal experience in Nigeria about 15 years ago with a fake drug, where I ended up on life support for a number of days after taking this fake drug. And so it made me commit my life towards finding a solution to this problem. And so this is the background.
Now, explain to us, how does it work?
So primarily, what we have is an AI platform that uses a proprietary nanoscanner. And so with the nanoscanner, what you do is that you scan the medicine before you take it. And then the nanoscanner sends to the AI platform information, or what we call a fingerprint of that drug, which the AI then analyzes and compares it against a reference database that we have in the cloud. And as soon as it identifies it, it sends back the report into your mobile phone app, indicating the identity of that drug and whether it meets the quality specification that is required. And all of this happens under 20 seconds.
Now, how long did it take to perfect this instrument? How long did it take to get it right?
It's been work we've been doing for the last 12 years. That's been the research experience that has been put into designing and developing it.
Help in prevention of fake drugs, especially in Nigeria, which has one of the highest fake drug productions.
Yes, so in Nigeria, one of the ways in which this is going to be helpful is that we are intending to have it in the hands of NAFDAC, as well as in the hands of all the pharmacies and medical stores across the country. We're also looking for partners and collaborators that will make it available across the rest of Africa and Nigeria as well. And the key benefit that this would have is that it would enable NAFDAC, hospital systems, and pharmacies and other collaborators to assure the quality of the drug supply chain across the country in real time. Because besides the platform I described, we also have a number of other data systems in there that visualize in real time where the bad drugs are showing up across the country. And so this would help NAFDAC intercept bad suppliers, bad batches, and bad actors across the country.
Now, I'd like to know if you're already in talks with NAFDAC. Is there any partnership going on? And tell us about it, if you can.
Not yet, but we are in discussions with them. We've been in discussions over the last 8 months with them, and we begin to see potential for us to actually begin a project with them. But it's important to note that we have over 1,000 units of this product across the world, even in places as far away as Myanmar. In Southeast Asia, we're currently working with the FDAs in these countries. So we're hoping that NAFDAC will be able to get this on board as soon as possible.
You know, it's interesting, the marriage, if I would say, between technology and health. I'm wondering how we can connect this to the economy as well. Are there any links?
Yes, there are a number of links. So, for example, our office in Africa, the head office we're operating for Africa, is based out in Ibadan. And we're doing all of the kinds of exporting out from that office. And that obviously is adding on into the ICT GDP for Nigeria. So there is that sort of very direct link to the economy of having a technology hub in the country and building out a technology platform out from Nigeria, creating jobs. We're generating export income as well. So that's the direct link. Now, the direct link between technology and health is essentially it gives the opportunity to do very scalable projects using technology, where in the past you would have needed to send a sample into a chemistry lab to do a test. Now you can actually do that testing anywhere, anytime on a mobile phone. And so that makes the work much more convenient. It digitizes all of the records, improves the productivity of the staff as well. So these are sort of the linkages between technology, healthcare, and the economy.
All right, thank you so much. And I have to say congratulations again, Adebayo Alonge, the CEO and co-founder of Rexall.